It's Gary Chimes from Lake Washington Sports and Spine, and I want to look at some different fluids that come from your own body that were used as part of treatments for different kinds of shoulder injuries. So the first injury was something called a calcific tendonosis, and what was happening is we had a patient who had a big chunk of calcium in the supraspinatus tendon, and the reason that happens is that the leading edge of the shoulder blade, called the acromion, cuts into the tendon, and it ends up forming a big chunk of calcium. So if we can get a close-up here, and we can see that this is a syringe where we pulled some of the calcium out. And let's take a look at that fluid. So if we can get a close-up here, we're going to see this is going to be the consistency of the fluid that came out. And it's actually hard to even get out because it's so thick with so much calcium that was removed. And you can actually get, if you can get real close in there, you can see that these chunks are kind of hanging out in the fluid. So that's from one injury, and I'm gonna see if I can get that last little bit out. Nope, I think that's all we're getting out of this right now. The second injury that we were dealing with was a patient who had a labral tear in their shoulder. So when we look at the glenohumeral joint, there's the ball, which is called the humeral head, and then there's the glenoid, which is the flat socket. And on the socket side, there's a labrum, which is like a rubbery cartilage similar to your earlobe. And that works similar to the way that the plunger works on the toilet, where you have a rubbery surface with some fluid that helps to maintain contact. So this patient had a labral tear, so we did a procedure called Lipogems, which is a micronized fat injection, where we take fat off of the patient's midsection, and then we process it in order to get this liquid, and it looks kind of like a lemon curd, and then we use ultrasound guidance to inject that back into the joint. So let's take a look at what this looks like when we pull it out. And if we get up nice and close up there, and we can see we got this thick lemon gel, and we put that into the shoulder, and it helps to heal up the margins of the labral tissue to make it look healthier. So a lot of what we're doing here at Lake Washington Sports and Spine is removing stuff. We're putting stuff back in to help the tissues heal better. Thanks, this is Gary Chimes at Lake Washington Sports and Spine.